So I've got all these questions around HRT, and so today I'm going to do a rapid fire and answer all of your questions. First question is, what is HRT? What are the benefits of it? So HRT is what it basically says on the tin, hormone replacement therapy, or as we like to really call it nowadays, medical hormone treatment. It's there to help alleviate the symptoms of perimenopause and menopause, and so it can really benefit for women going through this stage suffering with symptoms. So when can you start HRT? Well, actually, you can start it when your symptoms start. You can start it even when you have periods. So if your symptoms start when you're in your late 30s or early 40s or your mid 40s, then that's when you start hormone replacement therapy. And so it's given in what we call a cyclical manner or a continuous manner, depending on what stage of menopause you're in. So what are the different types of HRT? Well, actually, it can be prescribed as gels, sprays, tablets, and it comes in the forms of estrogen, progesterone, and testosterone. And also there's some new ones out there nowadays called Nalvi and Slind, which can be the progesterone component of your HRT, plus also the body identical natural micronized progesterone. So there's lots of different ways that you can be prescribed it. It is prescription only, and there's no one size fits all. So can you take HRT if you've had a hysterectomy, if you've had or got endometriosis or polycystic ovarian syndrome? The short answer is yes. And it's all about individualizing and risks versus benefits for each person, and including what you want to or what type of HRT fits in with you. Yes, you can go onto HRT if you've had a hysterectomy, if you have endometriosis, if you have polycystic ovarian. Can you take HRT if you suffer with migraines or are overweight or have high blood pressure? And the answer is yes. And what exactly does HRT consist of? Well, it consists of estrogen and progesterone prescribed in a cyclical or continuous manner alongside testosterone for some women. So does HRT help with vaginal dryness? And the answer is yes, it can, but also using local vaginal estrogen like creams, pessaries and gels can also specifically target that area. Does HRT help with your bones? Yes, it does, because we know that postmenopausal women, 1 in 3 will suffer a osteoporotic fracture. So HRT, particularly the estrogen part, helps with maintaining your bones and reducing the risk of osteoporosis. I get asked, is there an age where I'm too old to start HRT? And there used to be the idea that under the age of 60 or within 10 years of your menopause was what we would call the window of opportunity. Now we know there actually are a lot of benefits for older women to go onto HRT too, like for their bones, brain, heart, but it's all about weighing up the risks versus benefits for each individual. So it's about individualizing and maybe starting at a lower dose. And how long can you stay on HRT? Well, actually, there's no cut-off point. There's no age that you have to stop. There's no 5-year or 10-year limit to it. But it depends on you staying healthy, having regular reviews and monitoring. And it may well be that as you grow older, that your dose gets adapted and tweaked and changed and maybe even reduced. So I hope that's answered many of your questions around HRT. But I'm sure you've got more. So do drop them in the comments below. And don't forget to subscribe to my channel.